I apologize, my video did cut off, but we will start where we left off. So we had just hung our secondary bag. We did inspect the tubing to make sure there's no air bubbles. We did make sure the drip chamber is filled halfway with fluid, but before we proceed any further, we have to confirm the accuracy of our calculations. So our secondary order was to give amoxicillin 250 milligrams IV and 100 mLs normal saline over 15 minutes, and I did get 100 drops per minute. So since the drip chamber is filled halfway with fluid, we confirmed there is no air bubbles. The next step would be to set our timer to 1 minute. We would unclamp it and count 100 drops over the course of 60 seconds. And once we have counted that, we will reclamp it. We will monitor the patient to make sure they're not having any adverse effects, they're responding appropriately. And then after that, we will make use of this red label right here. Important information goes on here, such as the patient's name, the drug, the amount, the date and time that the infusion was started, as well as the expiration date. We did follow the 6 rights of medication administration in this video, which was the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. So once we are done with the procedure, we will take off our gloves. We'll perform hand hygiene. And then we will document the patient's response to the procedure. We will document the infusion, the name of the drug that we administered, of course, the dosage, where we administered the IV, whether if that was the right hand or the left hand, and as well as if the patient had any adverse effects. Then after that, once we've done our documentation, we will continue to monitor the infusion throughout the day to make sure that it is flowing correctly. We'll monitor the patient's IV site to make sure there's no signs of infiltration or infection. And I will conclude this video right here. Thank you for watching.